Welcome to Module 12 at eMend Healthcare. When a client experiences a medical or psychiatric emergency on the floor, seconds matter, and as a behavioral health technician, you are the facility's critical first line of defense. Stepping into a situation where someone's health is rapidly declining is inherently stressful, but by following a strict sequence of steps, you can remove the panic from the equation and take immediate, effective action. In this module, we will cover 3 exact protocols. You will learn to recognize the physical signs of an opioid overdose, safely manage a client actively having a seizure, and protect client privacy and rights while coordinating with paramedics. Mastering these specific protocols is the only way you will pass your mandatory naloxone return demonstration. Once you successfully demonstrate these steps, you will be fully cleared for independent client contact. Let's start with the most time-sensitive emergency you will face on the floor, recognizing an opioid overdose. The primary indicators of an overdose are respiratory. You are looking for a client who is entirely unresponsive, combined with breathing that is either dangerously shallow or completely absent. This close-up illustrates the secondary physical signs. Look for cyanosis, which means the client's lips have turned distinctly blue. Their extremities will feel cold to the touch, and if you check their eyes, their pupils will be constricted to tiny dots. Once you identify these signs, you must initiate the naloxone response. This means you must already know the exact physical storage location of the nasal spray in your specific facility long before an emergency ever happens. Go immediately to that location, grab the naloxone nasal spray, and prepare the device to administer a dose to the client. This is where we see the most common rookie failure point. Technicians often delay their emergency communications while they focus solely on the medication. You must call 911 before or during naloxone administration. This is an absolute non-negotiable requirement. To achieve this, dial 911, place the phone on active speakerphone on your shoulder, and administer the spray while speaking to the dispatcher. After you administer the naloxone, the emergency is not over. The client must be immediately transported by EMS to the nearest emergency room for full evaluation. Once the client is en route, close the communication loop. You are required to notify the client's emergency contact and file a formal incident report within 24 hours. Executing simultaneous action, administering the naloxone spray while actively on the phone with 911 is the exact standard required to prevent fatal respiratory failure, and it is exactly what you must do to pass your return demonstration. When the paramedics arrive, your role shifts. EMS requires concrete facts and documentation to safely treat the client, rather than panic or guesswork. Compile these documents for EMS: the MORS, history and physical, admission assessment, demographics, and vitals. Also deliver a rapid verbal history, recent vitals, drug of choice, last use, and allergies. If the client is conscious and able, have them sign a Release of Information, or ROI. This ensures their privacy and client rights are legally protected as they transfer into emergency medical care. A perfectly compiled emergency packet combined with a concise verbal history gives paramedics the exact baseline data they need to take over life-saving measures without a single second of delay. Now we transition to the next major medical protocol, responding to a client actively having a seizure. We need to clear up a dangerous television myth right now. You must never attempt to physically hold down or restrain a seizing client. And despite what you may have heard, you must never put a wallet, a spoon, or any other object into the client's mouth. Doing so can cause severe dental and airway damage. The correct immediate response is entirely environmental. You must quickly clear the area of physical hazards, pushing away chairs and tables to protect the client from impact injuries as they seize. Once the space is clear, follow your secondary steps. Check your watch to time the exact duration of the seizure, position the client on their side to maintain an open airway, and wait for EMS to arrive. Proper seizure management is a task of space clearing and timekeeping, not physical intervention. Keeping your hands off is the only way to prevent secondary traumatic injuries to the client and to yourself. After the client is safely in the hands of EMS, we move to post-emergency paperwork. eMend operates under strict California DHCS Title IX behavioral health standards, which dictate what happens next. Under state regulations, anytime a medical transfer occurs, you are required to officially notify DHCS within 24 to 72 hours. This brings us to a final critical failure point. Occasionally, a transferred client will attempt to leave the hospital against medical advice, or AMA, and try to return directly to our facility. The rule here is absolute. A client cannot return to care at Emond under any circumstances without formal, documented medical clearance from the hospital. Strict adherence to the 24-hour incident report timeline and the medical clearance rule shields the facility from severe compliance violations, and more importantly, it ensures the client is genuinely stabilized before they resume treatment. Let's recap your primary actions. If you see pinpoint pupils and cyanosis, you deploy naloxone while simultaneously dialing 911 on speakerphone. During a seizure, you clear the space to protect the airway without restraining the client. And after any medical transfer, you enforce the strict medical clearance rule before allowing a return to care. You now possess all of the exact tools and practical knowledge required to confidently pass your naloxone return demonstration. Please mark Module 12 complete on your onboarding checklist and enter today's date for your renewal tracking. Thank you for keeping Amen Healthcare safe.